Hello, everybody, and welcome to today's webinar as part of our work programme on the Commission for Healthier Working Lives. Today's webinar is exploring the practical steps that employers can take to support health at work. It follows on from the final recommendations from the Health Foundation's Commission for Healthier Working Lives, which explored the UK working age population health trends and their implications for the labour market. The way we're going to run today is Christopher Rocks, who was the head of the Secretariat for the Commission, is going to start today's webinar summarising the findings. And then delighted to be joined by four speakers who are going to reflect on that and expand on that. So the speakers today are Gary Dewin, who was a commissioner and is people director for the Co-op group. Sandra Dyball, who is the director of global health, wellbeing and benefits at Centrica. Peter Babudu, who's also a commissioner and executive director, Impact on Urban Health, and Nicola Smith, who was also a commissioner and is director of policy at the TUC. After they've offered some initial remarks, then there's an opportunity for discussion and Q&A, and so we're going to be using the Q&A function. This event is being recorded and it will be available on the Health Foundation's website within 24 hours, and a subtitled version will follow shortly after that. When we come to audience questions later in the webinar, can you please submit questions via the Q&A box at the bottom of your screen? And you can also upvote questions if you think someone else has already asked the question that you'd like addressed. Do submit the questions as we're going along, but we'll come to them later. For anyone who likes to post on social media, today's hashtag is #healthier working lives. So I'm going to hand over now to Christopher Rocks, who is going to share a summary of the Commission's findings. Christopher.
Great, thank you, Anita, and thank you everyone for being here with us today. I'll just try and get my slides into slide mode. Hopefully everyone can see my slides. Thank you. So as Anita said, the Commission has been working on this Working Health Challenge over the last kind of 18 months or so. And the Health Foundation brought together a wide range of commissioners to look at the Working Age Health Challenge. And I'll say a little bit more about it, but we're recognising that work and good work is really a positive thing for people's health. And we know we've had a growing challenge in this space. Our Commission, as Anita also suggested, brought together a really wide range of perspectives. So we had an employer perspective, the worker perspective, a local perspective. We've got Gary, Nicola and Peter here today. We also had a wide range of other perspectives on the Commission, from policy experts, work and health experts, people with lived experience in the group as well. So it was a really broad range of perspectives with some brilliant discussions. And I just want to say a few words about kind of what the Commission found, and I'll focus a little bit here on the role of employers in particular. But I'll just start with that kind of Working Age Health Challenge and kind of put some numbers on it. So for our research, we know that there's around 8.2 million people aged 16 to 64 who have a long-term health condition who say that it limits the type of amount of work that they can do. And that number, that 8.2 million, has been really going up over the last decade. So we've got a growing number of people of working age who have health challenges. And of that 8.2 million, around half are in work and half are out of work. So there's been a lot of attention, I think, on people who are out of the workforce, economically inactive, and have health challenges. But around half of that group are also in the workforce, and that number has been going up quite a lot. What that means is there's a growing number of people who are in employment, around 3.9 million, who are at risk of falling out of the workforce due to health challenges. And from our research, we know there's around 300,000, a bit more recent years, 200,000 people each year who fall out of work and then report a work-limiting health condition. And that's a really big issue. It means that that flow is adding to the number of people that are out of work each year. And we know that people who are out of the labour market, who do have health challenges, it can be really difficult to get back in. So there's around only around 3% of people with work-limiting health conditions who are out of employment for over a year actually return to work each year on an annual basis. So it's really difficult for people after a long period of time with health challenges to get back into work. So that flow is really important. And then lastly, we've spoken to a big number of employers in different parts of the countries. We've done roundtables, we've spoken to individual employers and groups of employers. And I think employers are really recognizing these working age health challenges, the health challenges in their workforce. And from businesses we've surveyed, over half think these health challenges are going to increase in the next 5 years. So it's not an issue that is going away. The Commission thought a lot about the role of employers in this. This is not a challenge that government can solve on its own. And what happens in the workplace is really crucially important to people's work and people's health outcomes. And we know that people with the same health condition, the same health challenge, be it a musculoskeletal issue, a mental health challenge, or a range of other health challenges, their experiences vary very differently depending on the workplace that they're in, depending on the support they receive from their colleagues, the type of work that they do, the size of their employer. It makes a really big difference to outcomes in this space. And the Commission highlighted a number of areas where employers can and do make a real difference for people's work and health. And in particular, I've just highlighted a few factors here around people management and line management. I'm sure we'll hear more about this in the discussion, but line managers are often at the front line of this, and line managers make a really big difference to how people are engaged in their work and the support that people receive. But equally, we know that line managers themselves are under significant pressure, and wider research will tell us that the health and well-being of a line manager makes a big difference as well to wider outcomes. I've just highlighted a couple of other factors here. I mean, job design and flexibility makes a big difference. How jobs are done, how they're performed, the access to flexibility. There's been a big increase in hybrid working after the pandemic, but we know that flexibility in work is not available to every part of the workforce. In sectors like retail or like health, it can be more difficult, but we've got a really great case study in the Commission's final report about frontline flexibility in health services, for example. We'll hear more about that too. And lastly here, I've mentioned access to timely support. That might be that interaction with the line manager, but oftentimes when there is a health challenge at work, access to external support services play a really big role, and employers can make a big difference there too. And I'm really happy that Sandra from Centrica is here today. We've got a great case study in the Commission's report from work that Centrica is doing, can make a real difference. I'll try and speed up a little bit. We know there's a lot of pressure for employers then, and we know that businesses are doing already quite a lot to support the health of their workforce. And this chart just helps to illustrate that. But the dots on the right-hand side, the blue dot shows you what large employers are doing. The orange dot is what a medium-sized employer between 50 and 249 employees is doing. And we see the vast majority of medium and large employers are investing in workforce health initiatives, and the types of things that they're doing. That chart helps to show that. But employee assistance programs comes out a lot, workplace adjustments for people, access to occupational health services. A lot of these things are in place in a big number of medium and large size employers. The green dot shows here what small employers are doing, those with kind of less than 50 employees. We can see that's a long way behind. So there's a real difference in different types of businesses in terms of what kind of workforce health initiatives are in place. Generally speaking, smaller employers are doing less in terms of formal investment in workforce health. They might be doing it more informally, they might be more reactive. And we know that a lot of businesses are in that kind of more reactive mode. So they might address challenges only once they've arisen, and that can be a challenge itself. So there are also big differences across sectors, I should say. And there are a lot of barriers for employers. I'm going to go through kind of 3 barriers really quickly that the Commission's report highlighted. The one that we've heard most frequently from employers is the kind of cost of access to external services or limited kind of time and resources on their side. So a real barrier kind of to doing more is the kind of cost and time here. But equally, when we looked at the kind of the system as a whole, we know that for some employers, that really low rate of statutory sick pay, so the amount of money that employers pay, the minimum amount that some employers pay when people go off sick, is actually very low in the UK. It's around 118, 119 pounds per week at the moment. And that means that for some segments of employers, the incentive to do much more to kind of proactively support the health of your workforce and the incentives to get people back into work early can be lower than they are in other countries. Statutory sick pay in the UK is a lot lower than it is in other countries. And lastly, on kind of incentives here, we know that there are a lot of legislation and regulations in place, but for employers that we've spoken to, they can feel that kind of fear of getting it wrong can be a barrier as well, and it can hold back effective action. So kind of ambiguity around roles, for example. Secondly, evidence and awareness of best practice. Employers we've spoken to, we might hear more about this in the discussion, knowing what good looks like for their sector and setting can be an issue. Being able to demonstrate the return on investment from initiatives can be a barrier for employers as well. And really what we've drawn out in discussions is that there really are big differences between different types of workplace, different sectors. What might work in an office environment might be very different to what works on frontline health services, to what works in a warehouse, for example. So having really clear evidence is really important, and being able to put that in place. And we also know the workforce health market itself is very fragmented. And I'll just bring this out with a chart. When employers do invest in workforce health, they don't always see the results that they expect. And we think employers are spending billions, if not into the tens of billions, on workforce health. And for the most part, for most employers, that is making a positive difference. However, when we've surveyed employers, we have heard, I've just highlighted here, we've heard in some cases, in a significant minority of cases, they're not seeing the results that they expect. So around 20% of employers say that employee assistance programs aren't effective for them, or 23% say occupational health services are not. And around health apps and technologies in particular, around a third of employers are saying that those are not proving effective. So it's really important that we have the evidence about what works, and we're making the most of employers' investment in this space. Lastly, I've spoken about what employers do themselves, but the kind of join up in the wider system isn't always there. So there's not very good join up. And when someone's at risk of leaving work, there isn't always a clear pathway for them to get back. And I've just kind of drawn out a couple of things here. I mean, around fit notes, for example, it's often the first conversation someone might have when there's a health issue might be with their GP, for example. But we know the vast majority of fit notes are recorded as not fit for work. And that can hold back, I think, effective action in this space, and give confidence to employers about and employees about what the steps are to kind of help someone with a health challenge remain in work. The Commission published its final report back in the 10th of March. Time flies, it's a couple of months now, but we published a final report and really set out a new approach to work and health. And we're really focused, kind of as the data shown, on that support to help people with health challenges to stay in work. And what we really did, and kind of illustrated here on the right-hand side, is we looked at the journey that someone could be taking from being in work to potentially being on an absence, to potentially being out of the workforce. And we really try and say, where are the steps that we can take, and where can we have early action to prevent people from falling out of work? And at the moment, we think that that system to prevent people falling out of work just really isn't there, and there's huge gaps in support. We had 7 recommendations, headline recommendations in the Commission's final report. I'm just going to highlight a few very quickly to give a flavour and to try and help set up the discussion. So our first recommendation was about updating and applying best practice in different sectors. We're really calling, the commissioners were calling here, for government to work with sector leaders to help bring together the data and the evidence, and to really to review what really works in practice for different sectors and settings. And we were thinking here around not just kind of what helps people stay in work, but kind of how do you get job design right in the first place? I mean, for example, for someone doing a frontline care role, what is it the kind of right mix of jobs and the kind of flexibility that people could need, or for someone working as a bus driver? So really thinking about job design, accessibility, and the steps that you can take to help people remain in work, but with a focus on specific sectors and settings. And we don't really have a lot of that sectoral coordination in place in the UK as compared to other countries, but there are opportunities, for example, around sectors like social care or other sectors where there's real significant challenges. You could really build more of that sector working. Secondly, we know that what happens in the first 4 to 6 weeks makes a huge difference to whether or not someone can remain in work, and access to kind of early caseworker-led support. By that I mean access to an individual who can give, advocate for the individual that's maybe facing the health challenge, but give advice to the employer around what steps you can take to help someone stay in work. That can be really, really effective and can make all the difference. And we called for the government to really embed that early intervention model. We know, and we'll hear, I think, from the discussion today, some employers are already doing a lot. There are also a number of pilots, Work Well pilots, Inactivity Trailblazers, NHS Accelerators, a number of pilots that are being rolled out and put in place at the moment. There's a lot to build on and to develop to make sure that early caseworker support is in place and is consistently available for different employers. So a lot to think through there. And just kind of crucially, I think, I will say that really needs to be a holistic approach as well. It's not just about addressing someone's health issue oftentimes, it's about the practical steps that can help someone remain in work. And it's also thinking health, it could be the presenting issue. There can be a lot around that as well in terms of wider socioeconomic issues as well. I'll wrap up, but just on statutory sick pay, we know the Employment Rights Bill is already going through Parliament and will do a lot to improve coverage of statutory sick pay to make sure that employees are basically more likely to be eligible for statutory sick pay. But as we said earlier, the level of statutory sick pay, £119 per week, almost, really remains too low for people to live on. It really risks financial hardship. And what that means is there's a big risk of people who are off absent from work, either come back to work too early and they haven't made a recovery, or the people who are absent for longer might not remain on statutory sick pay. They might fall out of the labour market and they might move towards the benefit system. And it's that preventative approach that this doesn't address. So we really call for the government to review the level of statutory sick pay within this parliament and the design of our statutory sick pay system to set a course towards a fair system. We are aware there's a lot of pressure on employers at the moment, but we think this is a really key part of a proactive work and health system. And then just lastly, this is our sixth recommendation, hence the jump in numbers, but we also recognise that for some people, they're in a role that if they have a health challenge, that role might no longer be suitable for them. That sometimes when ideally someone can return to the previous role, but sometimes it might be a physical role they can no longer do, or an incompatibility in the role. But it's really important, if somebody can't continue in their current role, that we're really looking to really quickly support someone to make a transition into a new role. And we called on government to work with local areas to look at kind of job matching and job brokerage services, working with local areas and local employers to really help support transitions, so that people can find work that really will suit them, will be sustainable. That's just a flavour of the recommendations. There's a lot more in the Commission's final report. There's a lot more evidence and reports behind it as well. But I'm going to stop there. I want to hand back to Anita and really hear from the panel discussion. But thanks everyone for your time.
Thank you very much. And there are already a few questions. Just to reassure you, once the panellists have had an opportunity to give their thoughts, we'll come to all of those questions as well. So we're going to start out, I think, with some reflections from Gary. And Gary, you've been, I think, at the Co-op for 20 years now, working now as people director, and so lived through a lot of the changes that Chris was talking about. Gary's also a non-executive director for the Co-op's funeral planning business, does a lot of work with schools and young people. And that's very important, because I think when we think of health and work, we often think of older workers and the aging of the workforce, but there's a lot of issues around young people. And as Chris said, health is often one of many challenges, and I know you've also been doing a lot of work on financial well-being, which is really important. So really interested to hear your observations, Gary.
Thank you, Anita, and thank you, Chris. Good morning, everybody. As Anita said, I work for the Co-op Group. As I'm sure you're aware, the Co-op is a large employer spread across the UK. Lots of different businesses, lots of people doing lots of different jobs in lots of different places. So that gives us an interesting perspective on the well-being question. And it's certainly a journey we've been on for quite some time, and there's an awful lot more distance, if you like, to travel. And I was really pleased to be part of the Commission, because it gave me really a good opportunity to share some experiences, but also to learn a lot too. And this is really very much the journey we're on. I mean, one of the places I would start is the sense of the cost to employ. As an employer has probably never been higher or never felt higher. And the recent NI hike is significant. And I know some people understandably might roll their eyes at that, an employer talking about increasing costs but still making money. But it's a genuine issue. And it's one, really, if anything, it actually makes the reason even more compelling to have a coherent strategy around health and well-being. Not just the current situation, but when you look at all the data that shows the current trajectory, it means it's even more compelling than ever. And one of the things that strikes me is that businesses are constantly focused on efficiency improvements and analysing what could be done better, what could be improved. But I'm not sure businesses across the UK today have spent enough time looking at the critical resource of people in the same way. So what can we do to keep people in work? And when people inevitably are poorly, what can we do to get them back into work and support them? And I think that's a really key area. And the Commission's report throws up a number of recommendations and really a number of starting points, I think, to start to have this really important discussion. But it's the proactivity, I think, that's critical here. And just a couple of things I was going to share, I'm very conscious of time, is my one of my primary concerns when I was first involved in this was that the focus was going to be entirely on employers, that it was all about employers. And I don't think that's right. I think employers have a hugely important role to play, but I don't think they can do it on their own. And again, I'm hoping what we'll see and what we started to do and what we're starting to see is that joined up thinking and as working across the piece, but it's government, health support services, employers, employees, trade unions, people working together to find solutions here. And what we've found is where things haven't worked to date or haven't worked as well as we'd want, it's maybe because we didn't start in the right place. We didn't have the right data. We knew what our absence numbers were, but we didn't really know the reason or the root causes for sickness absence. Maybe we weren't recording it in quite the right way. We haven't necessarily given our leaders and line managers sufficient information, insight, education, training to actually help and support both themselves and also colleagues. And when we have got things right, sometimes actually external support services haven't worked. We've created a pathway which would enable someone to get the health treatment that they need, but couldn't get it because the external services, whether that was the health service or whatever else, fell down. So it's very much, I think, a holistic solution we're looking at, but there are absolutely things that employers can do and are doing. And I think for me, when I look at the successes today, it has been around building kind of trust around the products and the services so that colleagues and employees know that it's for them. There's so much messaging goes out to employees. It's so important, actually, that they understand that, we started with the wellbeing brand, for example. Now, you can't just put it out there and expect it to do everything you need to do. You've got to keep refreshing it. But there was some real value in having a wellbeing brand, which actually gave people, a place to go to, a place they could trust. And on the back of that was products and services that they asked for. Because, again, one of the failings, or one of my failings when we first started this journey, was thinking we knew the answers. We thought we knew the answers for colleagues without necessarily asking them or using data to back our products and services up. And if you're not careful, I think you end up with a patchwork quilt of potential solutions that doesn't necessarily hold together. So as I say, that education piece, knowing your particular business, knowing what is needed, getting to some of the root cause, getting the data right, has been hugely, hugely important to us. And I'm sure the debate will come into some of the specifics in more detail. And I'll hand back to you, Anita. Hopefully that's a reasonable opening start of a 10.
Brilliant. Thank you. And I think next we're going to have Sandra. And Sandra is director at Centrica, as I mentioned, and has got 25 years experience in hospitality, retail, SMEs and the utilities. And I think one of the things that the Commission was highlighting is the need to have tailored responses to the different contexts of different sectors. So looking forward to hearing from you, Sandra.
Great, thanks, Anita. So within Centrica, we have been on a multi-year journey. We started our journey back in 2016, and very similar to what Gary mentioned, we weren't aware what our colleagues wanted. We at that point, we didn't even know what our absence rate was. We were kind of bit of a postcode lottery. And back in 2016, we decided to work with a partner of how do we manage the occupational health of our people? What is the underlying health conditions of our people? And the way it works is that if a colleague goes absent, on day one, they record their absence. That is then flipped into our occupational health provider. And with that, we then work through what those SLAs are. If it is work-related, then we aim to get a call to that colleague within 24 to 48 hours. And that's really quite critical with that early intervention of how can we get the right support for those people? Are they with the NHS? Do we need to do something different? And equal to that is to keep the line manager informed. Line managers have a great responsibility, and sometimes we need to make sure that they know what's going on and that they understand what support they can give. Fast forward to 21, we introduced quite a radical healthcare plan for all, which is whereby currently we have 19,500 colleagues and 3,500 dependents on our healthcare plan. And that has bolstered our occupational health support. So what that means now is that if a colleague needs access to treatment, which isn't readily available on the NHS, and we all know the current state of the NHS, what can we do to keep those people in work or get them back to work sooner? And what we're able to evidence now is that those colleagues who access the support of the healthcare plan, be it through MSK particularly, then do not go absent for the following 12 months. That's been quite revolutionary for us. And some people will say, but Sandra, you're a big organisation, you can afford to do that. But that option is also there available for SMEs as well through what's called a master trust. So that's been quite good for us to keep people in work, get them back to work quicker, and do the intervention as well as soon as we practically can. But we're not there to replace the NHS, and that's quite key. Overlaid with that is that we then introduce the management advice line. Managers don't have the answers to everything. It's important that they get the right support from a professional, and they can ring this advice line to talk about this person's got this condition, that condition, what do I do? What reasonable adjustments do I need to make? And then if we have somebody absent, we will work with the employee, the case manager, who's a specialist, and the line manager on how do we get that person back to work at the right time so they don't come back too soon so that they then go off, but it's the right time with a reasonable return to work plan. That comes at a cost, as Gary's mentioned. We have seen hikes in the national insurance, but health benefits are taxable for the individual, and that can impact the lowest paid in society, especially around national minimum wage. So I think there is an ask for me of government around how do we make health benefits easier? How do we, and I don't think we're going to get this, non-taxable, but then how do we, as an organisation, especially SMEs, be able to claim back almost the £500 medical exemption you have from a tax benefit? How do we make it easier for employers to do more when we're asked to do more? And I think with that, Anita, I'll hand back to you.
Thank you so much. Just one thing, you mentioned briefly a master trust for SMEs. Could you just briefly explain that in case people are not familiar with that?
Yes, certainly. So within healthcare, there are two traditional routes of providing healthcare. One is through a private medical insurance, through your big insurers, and that brings an element of insurance premium tax, which can be cost prohibitive for most companies. Then there is another mechanism called a trust mechanism, which is what Centrica run, which is whereby Centrica pays into a trust, and it's a medical trust. You have to go through quite an element of governance, and that enables you to do your own rules, your own regulations, etc. But for SMEs, there is an option whereby SMEs can get together and are able to pay into and run a master trust. And organisations do that. It's another way and an alternative to private healthcare insurance, which might be seen as expensive.
Wonderful. That was really clearly explained. Thank you so much. And then third speaker is Pete, who has worked in senior leadership roles at the Youth Endowment Fund and the Social Innovation Partnership. He's been a councillor in Southwark and chair of the Blagrave Trust, and as I mentioned, he was a commissioner on this work for the Health Foundation, and is the executive director at Impact on Urban Health. Pete, over to you.
Super. Thanks, Anita. I'm really, really excited to be taking part in what I think is a crucial discussion. So at Impact on Urban Health, we are a health-focused foundation based in South London, and we're really just committed to ensuring that everyone has a fair chance of living in good health, and we'll collaborate, learn and share with anyone who kind of shapes the environments where people live. And I mean, really doing that, you have to be interested in the core drivers of health, like where people live, where they work, the air they breathe, the food they eat. And I mean, fundamentally, I think to the point Gary made, I think most employers recognize how key having a healthy workforce is and want to do what they can sustainably to help people live healthier working lives. And good work is key to people's health. And over the last 5 years, we've invested £2.5 million funding projects related to health and work. And I'll just talk about a few of those, focusing on two key themes, just really disparities in the access to good work, and then the role of workplace flexibility, so building on some of the things Chris mentioned. And I mean, first to disparities, I think we must acknowledge that the negative health impacts of certain types of work are not felt equally, whether it's low paid people, young people, and particularly those from minoritized backgrounds, they'll be more likely to be in frontline, physically challenging roles. And as in the Health Foundation's recent research with Runnymede showed, I think often factors like structural racism can fundamentally affect how people navigate factors like the nature of their employment and what they feel entitled to. I mean, in one example, we commissioned a partner, TimeWise, to survey 4,000 workers, and there were huge differences based on people's race about their likelihood to even consider taking advantage of new rights around flexible work. So there's just some really kind of knotty disparity issues there. And it's driven by factors which can range from the fact that traditional health and employment support can fail to reach certain workers. There can be big differences in delays to getting diagnosis, to the different sectors or size of firms that different groups are represented in. And I'll just secondly go to flexibility. And through the work of the Commission and other research that we've funded, I think we've seen that flexibility can be a really powerful tool in helping to create more equitable health outcomes. Notwithstanding that, I think as Gary rightly flagged, there can be challenges in implementing it. And I mean, it's really important we're honest about those challenges. Now, post-pandemic, I think flexible work has become so synonymous with hybrid working, and it risks creating a two-tier system for those frontline workers for whom it's not an option, which is the majority of our workforce. And I think we just need to think more fundamentally about the nature of flexibility. It's about more than just location. It's about autonomy, choice, and control over one's working life, alongside getting a decent wage. And I mean, whilst there can be challenges, I think organizations can develop approaches that can empower managers to proactively support individuals, even in roles that are traditionally seen as hard to flex. Now, another piece of work that we did with TimeWise and was reported in the Commission's final report, they worked with a range of employers to try and test the feasibility of introducing greater flexibility, say in shift patterns or in other areas, and to try to look at the benefits it brings. And they worked in the health space, so with St. Thomas's NHS Trust Hospital, which is a kind of huge employer, but also in retail with Wix and in construction with Sir Robert McAlpine. And there were some really positive takeaways from what was admittedly a kind of pilot. It showed the kind of positive impacts on staff well-being and even reduced sickness rates. And of those kind of surveyed who took part in those pilots across those three organizations, it went from just over 50% saying that their work allows them to maintain good personal health to 82%. And so just, I think really for those who are interested in kind of trying new approaches, there can be real power in exploring greater flexibility. And now, like beyond what kind of employers can do, I mean, we're supportive of policies like introducing the right to request flexible working from day one. But I think we do need to be honest that for them to be effective, we have to recognize that employers and particularly SMEs need support to understand how to implement such changes in a way that works and can be accessed equitably. And I think there's just a few points before I kind of wrap that I'd highlight in how we could help employers, particularly SMEs, do more of what they want to. And I mean, firstly, I just reaffirm the Commission's findings around early intervention. I think it's so rightly highlighted we need to do more to move from late stage intervention to early support, and really behind that kind of idea of a caseworker-led model that could play a major role in just helping individuals and employers address work and health challenges before they escalate. And then I think more broadly, the need for kind of targeted support and clear guidance in ways that employers can readily access. And so that's both supporting the call for like more clarity around what are kind of good evidence-based approaches, but but also looking at ways that you can get that support and guidance even to small businesses. And one project we funded with the Design Council was specifically looking at utilizing business improvement districts as a route for employers who didn't feel that they could afford to kind of directly contract to still get support with evidence-based guidance tailored to different sectors and businesses of different sizes. So I think there's some really kind of promising approaches out there. And the third thing I'd say on what I think employers need, and we're representing it fantastically on this call, is candid sharing. Like, we need to be more open about what works more or less well. And we know that generic wellness programs and certain apps, they're probably not as effective as changes to job design or improving management practices. And I think kind of some of the examples that Sandra brought with Centrica and early absence management, I think spoke really powerfully to that. And finally, I'd just say that we need to recognize that no single entity or sector can solve this alone. And we need partnership between government, employers, and employees if we're going to achieve systems change, because ultimately healthier working lives, it's a health issue, but it's an economic issue. And frankly, I think it's a moral issue as well.
Thank you so much. And then finally from our panelists, last but very definitely not least, Nicola Smith, who is was also a member of the Commission and is Director of Policy at the TUC. Nicola.
Thanks so much, Anita, and it's really great to be here and to see so many people on the call, and also to have heard so many really great examples of the good employer practice that we know is out there across the economy in this space already. Many of you will know the Trade Union Congress represents trade unions and working people across the country, currently about 5.5 million working people from 48 affiliated unions, working with employers across the public and private sectors in all sorts of industries to make sure that people have voice at work, and that inevitable power imbalance that there is in the workplace is somewhat offset by the benefits that collective representation can bring. I've got a few minutes. So much has been said already. I suppose the really key point for us is that, as many people have said already, good work is absolutely the bedrock of a stronger economy. It's not an optional, it's not a nice to have, but it's an essential to success, both at an individual firm level and at a macro level. We know this is what the international evidence tells us. We know the OECD are really clear that countries with better job quality and more inclusive labour markets perform better than those without. And we know why this is, because where we've got better job quality, there is higher employment rates, people are better able to move into and to stay in work, retention is higher, people's health is better, and employers invest more in the technology, in the skills, in the people, just as Gary was saying, than where the incentives point to just running really cheap labour models. So there's a really important reason to do it. And we know that where it doesn't happen, and where work is bad, it's really detrimental to health. And the evidence from the Commission is clear on that. Since the Marmot Review that many people might have known about in 2010, that was really a sort of point in public policy where there was a really definitive questioning of the idea that all work is good for health. Good work is great for health. It helps people feel motivated, it builds confidence, it builds resilience, it gives people an income and the living standards they need to build a decent life. But bad work can have the opposite effect, and cycling between very bad work that is bad for health, that leaves people with a higher chance of developing health conditions, of not being able to progress, and spending longer times out of work is hugely detrimental, both to individuals and to their families, and also to the wider economy. And many people will have seen, and Chris referenced this point as well, the Charlie Mayfield review, and that focuses really on the fact that this huge challenge we've got as a country of more and more people being out of work with ill health. Part of it, not all of it, but part of it is about keeping more people in work. And I think it's about 25% of people who are entering that growing number of working age adults who are out of work with ill health are entering that group from work. And we think much more can be done to keep people in jobs, and job quality is part of that. But I suppose, we already referenced a little bit about the Employment Rights Bill at the start. And I suppose my message on that is that from the TUC's point of view, and I think on the basis of the international evidence and what our competitor economies are doing as well, higher standards of employment regulation and higher standards of employment protection are part of the solution to this problem. They're not the only solution. We've heard many other important parts of that discussion already, but they're definitely part of it. And often you hear about in the press, certainly, the costs that employment protection can bring. But when you look at the details of individual policies and what they mean, I think it's really important not to overstate this. Of course, there is cost of improving employment standards, of paying employees, of investing in decent job quality. That's a reality for any employer. But the impact assessment around the Employment Rights Bill models the total cost of all the measures at about something like 0.4% of the UK pay bill. Most employers are affording pay rises very much above that, just by the by. But what they don't talk about when they run those headlines is the benefits that investment brings. And the benefits, I think, are very well spelled out and have already been discussed by many others on the panel. And our analysis would suggest that annual cost is probably going to be very much offset, many times over by the benefits. Our central estimate would be, something like 13.4 billion. The benefits that will come from reduced stress, increased well-being, improved labour market practice, reduced conflict, reduced disputes at work. So I suppose my plea is when people hear these headlines about costs, recognise that, everything is a cost and you invest because you know that the benefits are there to come. And when you think about the sorts of people's jobs that are going to be affected, you can see why this legislation is so necessary if we are going to drive up working age population health. The sorts of people that we've talked to at the TUC and who are represented by our member unions, care workers working through the pandemic on 0 hours contracts, who got a cancer diagnosis and then had no sick pay, found themselves immediately out of work because their hours were just immediately zeroed down. Warehouse workers working hard all day on production lines, on carrying boxes, get an injury, face the immediate sack. No protection at all from dismissal in that circumstance. No help to improve their health. No paid leave. Production line staff who are told, despite broader economic success in the business, they're all going to lose their jobs unless they sign new contracts on lower pay and worse holidays. And childcare workers who can't plan anything like their own family lives day to day because they just have no notice at all of when they're going to work and no control at all over when they're going to work. Those sorts of jobs leave people with high stress, with poor incomes, with more ill health at work, a higher chance of developing injuries at work, lower retention, higher recruitment, and much wider, higher costs in terms of healthcare and social security for the wider economy. So I suppose my strong message would be that isn't the basis for a strong and productive economy, and there are real gains to be had if we can start getting this right and start driving improvements. Now, very quickly, because I know we need to move on to questions, 3 key things to say on this. Regulation is a floor. It is a necessary floor in my view, but it is absolutely not the only change that we need to see. I'm sure we'll have time to discuss this, but if we're going to see higher levels of employment protection, it has to be properly enforced. The good employers that are playing by the rules cannot be undercut by those who do not decide to follow them, and that is going to need more investment in health and safety and in making sure that we've got the labour market inspectors that we need to help people get it right. We need transition costs and support for employers, particularly those, I think, in some employing many people in lower paid roles in industries where employment is high and where we know the majority of people moving from social security into work are going to be employed. I would like to see an industrial strategy that recognises that hitting an 80% employment rate means helping more people stay in jobs and means helping employers in high employment sectors transition from the sorts of models we have at the moment with high levels of insecurity over shifts to those better quality jobs with high productivity and that have got a higher chance of people staying in work. And finally, there's lots of changes coming for collective rights in the Employment Rights Bill to make it easier for employees who want to organise into a union, to join a union, and to give their members the opportunity of collective representation at work. I think we need a step change in terms of how we think about the benefits that trade union recognition can bring and the realities of what productive union union-employer working relationships are looking like already across the economy. Where you've got union reps at work, they help identify and resolve problems before they become embedded. Workplaces are safer, training rates are higher, and people have voice. And you hear about what's happening on the shop floor, and you know about it, and you can build it into your planning, and you can take action before it becomes a big shock later down the line. So there are real benefits to boosting union representation across the economy, and that's also another important change that I think we like to see. I feel like I've got an awful lot more to say, but I'm also conscious that I've taken up a lot of time already, so I'm going to stop there. There's lots more we need to do. Let's hope this is a journey moving onwards in terms of thinking through how we can all work together to drive up employment standards and see more of the sorts of good work that we know is health enhancing across the economy. Thanks, everyone.
Brilliant. Thank you very much. I mean, you've all talked about how multifaceted this is. You know, people are not all the same. The issues they face are different. The support that they need is different, and typically people don't just need one thing; they need a mix of things. And several of you have tried different things, and there is different evidence base for different things. A lot of the questions that have come through about also coming through from the perspective, and Chris touched on this, that see a lot of people work in small and medium-sized organisations. Got a number of organisations at the moment that aren't doing as much in this space as they would want to, and may well recognise that they need to do more, but can no doubt feels quite daunting to think, where do you start? Yeah. So interested really to think both, you know, practically at the moment, where would you start? But also, I guess, have we got a gap? I mean, whose job is it, as it were, in the system to make sure that employees do know what good looks like here are helped? Organisations that don't have a Sandra and Gary, yeah, with more than 20 years experience. So reflections on particularly for those smaller organisations, or organisations that are just going, yep, this matters. I get this, but we've not done a lot. Where do we start? Who would like to come in on that? I might ask Gary and Sandra for you to start first with your experience. Gary, what do you think?
It's a great question. I think knowing your business, knowing your data, knowing the core reasons for absence, and actually starting from a good baseline is really important. I think once you understand the data and what your business is telling you, and actually, in fact, what your people are telling you, I think that gives you a great way in to start to work from that point. Otherwise, you're not quite sure what challenges or what problems you're trying to solve for, and there is so much out there. I think that would be one of my key points, is that would be clear on what it is you're trying to solve for. And then also, I think, and this is relevant whatever size of business you are, some people are fantastic at the job, but it doesn't mean as a line manager necessarily they are very adept at managing absence and sickness. And actually, investing time and spending time and that being an important part of a line manager's and a leader's job, I think is really, really important. And actually doesn't require lots of whizzy apps or necessarily huge amounts of investments in products. I think actually understanding how to deal and how to manage and how to work through health challenges with employees is really important. And the other thing that strikes me here is actually this comes in lots of different shapes and sizes. And I think the panel's talked about this, and the Commission certainly talked about this too, in the sense that absence can come from a number of different places. So having to think about this holistically, we find financial well-being can be a driver of ill health, much more so than ever before. And that's an area where people aren't necessarily comfortable talking about. But again, understanding kind of, if you like, the bigger picture, but also understanding specifically what your business needs and is reacting to, I think is a crucial part to start. And I don't think you need to invest some time, but I don't think necessarily to invest a huge amount of money in that to start with.
Yeah. Brilliant. Sandra?
Yeah, I agree with everything that Gary said. I think understanding what your colleagues are saying to you, understanding what they need versus what they want, because they're two different things, and being clear about that. And then I agree, there is a lack of a common framework particularly for SMEs around health and well-being. We look at some people look at the two very separately, and they're not. They are so interlinked. The HSE executive have got lots of great free material on their website. TUC have got, and the unions equally have some great free available stuff on their website. People like Mind for mental health. But as Gary says, it is time. What I would say, if you are someone who has an app and it's not working for you, be bold, be brave and stop it, because you can probably look to do and put that money somewhere else rather than for an app that's not working for you.
Brilliant, thank you. I might move us on to another question. One other one, which is quite interesting. So Chris's presentation at the beginning showed very much the importance of thinking about and focusing on people who are in work, both because a lot of people in work are wrestling with health conditions, so that must be an issue for productivity, but also then that once people fall out of the labour market, you know, it's much harder to get them back in. But it is quite interesting that the focus in the UK on policy has very much been about return to work rather than retention in work. And there's a question about why people think that is, and whether or not there's any international good practice looking much more at focus on in work. And I don't know if Nicola and Pete, you want to say anything about that balance, if you like, between retention in work and return to work. And Chris, I'm going to ask you about the international best practice.
Thanks, Anita. I mean, I think part of the policy focus is because over the last decade, certainly, we've had very little government focus on the quality of work. And, you know, the government has really had an agenda of presenting its view as getting out of the way and leaving people to it. And as I tried to say at the start of my presentation, that is really just out of step with the economic evidence and the international evidence about what drives good practice and good quality work. And many of the companies operating in the UK are used to operating, some of our largest employers in other European countries, with much higher labour standards than they have been asked to comply with here. But I think that focus has, you know, driven a government policy focus has sort of driven public policy discussion to the problem of people who aren't in jobs. And the public policy view, certainly under the last government, was, you know, any job is fine. And now we know that's not the case. There's a welcome focus on what more we can do and the role of good quality work in being health enhancing and in improving economic performance. But, you know, we're at the start of a discussion on that. And I think, you know, there are, just to sort of reflect a bit back on the previous discussion, you know, there are advice services and support out there, but they also do need more investment. I know this is not easy. You know, there's a lot of new changes coming down the track. There will be more information that employers need to get themselves up to speed to. Unions will also need to get themselves up to speed with the new legislation. We'll, you know, and we'll want to work with employers productively to make sure that it can be put in place in a way that works for individual workplaces. But, you know, you've got organisations like ACAS. I remember people may know the Advice and Conciliation Service, you know, a government agency responsible for improving working relations across the economy. Years ago, the end of the last Labour government, they ran a pilot looking at small businesses, compliance with employment legislation. I remember reading the findings then. There was very little compliance, but very little of that non-compliance was willful. It was because people didn't have access to the advice and the information and the support to put the regulations into place. And they were actively asking for more HR support. Now, we've had little pockets of that over the last decade. There was the Be the Business initiative. There's been some really good CIPD pilots that were set up. The work of Timewise has already been referenced, you know, but some of this, I think, does unfortunately, all roads come back to funding, come back to the priority that public policy places on it. And if you look at some of the agencies that need to be out there supporting businesses more, they haven't had the funding settlements that they need. So, you know, our labour market enforcement by ILO standards is something like 1,700 inspectors short of where it needs to be. That is not impossible. to build a roadmap to how you might get to that standard, but you need to start. Similarly, the CIPD, Chartered Institute for Personnel and Development, have said that funding for the Health and Safety Executive needs to rise by something like 100 million in real to get back to where it would be in real terms in 2009-10. So again, you know, that's not me as a trade union representative sitting here calling for more money. That's an employers' body recognizing there's a need for investment in some of these services to help employers get it right, and to make sure ultimately that undercutting isn't allowed to stop those who are playing by the rules and doing the right thing from getting the benefits of it. So I think there's a lot to unpack. Some of it is investment, some of it is drawing on the existing good practice, but absolutely support is needed to help people get it right, and we know that very many people want to.
Brilliant. Pete.
I think Nicola covered so much of that. Just this compounding of factors. One, owning the people out of work and getting them back in is such a knotty problem, as Chris highlighted. The likelihood, if you've been out of work for a year, is at best a kind of few percent. So I think that knotty problem has taken a lot of attention. I mean, in recent years, the over proliferation of really low quality work has just immensely just demanded more attention, as we've seen, kind of particularly post COVID, the widespreadness of it. But the kind of third thing I'd add is also, I think, just kind of greater recognition of the health harms of certain types of work, and just really fundamentally appreciating that. One of our other partners that we've worked with in our kind of health and work activity is called Liminal, and they work with night workers. And you have nearly 9 million night workers across the country. They are 44% more likely to have diabetes, a very high risk of divorce, and other health harms. And just understanding and kind of appreciating those risks and the damage it's doing, I think has just had to kind of fundamentally move up the policy agenda. And also the recognition, even if often in pilot basis, that by making relatively simple changes, like if you're kind of testing and learning, you're able to have quite a kind of positive and scalable impact there. So I think just really that's part of what's created a bit more space for thinking about, like, you know, what does good quality work look like, because we kind of understand better the harm that can come from lower quality work, and the avoidable harm in so many cases.
Yeah. Can you say a bit more there, Pete? Because obviously, I mean, so if you take things like, you know, the thing I work on, the NHS, yeah, we have to have staff working through the night because people need to be kind of cared for. We're also observing, obviously, with a lot of the ill health that people have that affects their work, that's often fluctuating conditions, you know, and so harder to potentially to adapt around compared to, you know, I mean, we've all probably had an occupational health assessment to make sure our chair at work is right. You know, that's much more simple, obviously. There was a question about the kind of job design. Could you say a bit more about what you think is some of your experiences about the sort of what good looks like in thinking through health-friendly job design?
Sure. So I think there were some core themes here, like for our work with TimeWise. I think Gary kind of touched on one similar points, that often it was about our managers having higher quality conversations with staff about what their needs may be, and recognizing that even if hybrid working is like not practically possible, it can be things around the kind of nature of shift patterns, or the kind of extent of which you're going to have to do certain types of long hours and then that you shift onto another routine, and recognizing that those can have a kind of really kind of impactful impacts on health. In some of the training that Liminal does with night workers, it's about a combination of like both informing employees and workers about some of the steps that really are helpful for kind of getting through night shifts well. I mean, my wife's a doctor in the NHS.
Yeah.
Night shifts yesterday, and like one of the kind of core points is about the importance of eating. being given the space and time to do that. And so practical, like kind of steps and measures like that really can kind of make quite a notable difference at pace for people.
Yeah, gosh, you know, hot food, good nutritious food out of hours in hospitals, very often not available, nowhere else open. Yeah, Chris, can I ask you to come in particular the question and the point that was made about international examples, but also can you follow that up also with questions about what the reaction has been to the recommendations and what the next steps are?
I'll say a few things. So one, just on the international comparison.
Oh, we can't hear you very clearly.
Am I coming through now? I've come off mute.
That's better.
Good. On the international comparisons piece, I think just to say, we know the UK has a relatively high employment rate, but we are behind some European countries, and we can look at countries like the Netherlands where employment rates are higher, and particularly for people with health challenges. So there's scope to improve. And when we look internationally, I think it is that two things. One, it's the focus on early intervention, which really stands out and makes the biggest difference. And it's a sustained investment. So I think the Netherlands is often cited here as an example. And we know from over a course of a number of years, the Netherlands had a similar challenge as we had now, a big work and health challenge. It was appearing in the benefit system. And they made significant changes to how they handle work and health. Famously in the Netherlands, employers pay sick pay, significant level of sick pay for up to 2 years for their employees when they have health challenges. So they really moved the responsibility towards employers. And that made a big difference to the outcomes in the Netherlands. But it took a sustained investment and big changes over a number of years. Now, I think just one thing to say, there isn't one international model we should be looking at. There are different countries we can pick up on. The Netherlands, the employer responsibility is really strong. In Denmark, the responsibilities of the state and local areas in particular are much stronger and much more developed. But I think where other countries stand out is a sustained investment, and it's about really having clear steps to have early intervention really clearly embedded in a system approach. And we haven't really had that in the UK. Just on the reaction from policymakers, I think I'll say positive overall. I think we know there is a really, really big challenge facing the UK, and we know there are really big fiscal pressures facing the UK as well. So we're in a context where there isn't an awful lot of money, but I think there are really some positive steps being taken in the green paper, the Pathways to Work green paper. There's already some recognition for some of the things the Commission was calling for around how we can make support for people out of work with health challenges more holistic and more accessible, and also kind of how we can support returns to work as well, which I didn't mention earlier. So we could see some of the recommendations getting kind of recognised already, and I think there's a lot more that we can do. There's obviously a Keep Britain working review being led by Sir Charlie Mayfield as well. We're looking to see kind of some of the Commission's recommendations reflected there, but I think it is important to say this is something that's going to take bold and sustained action and quite a big change, and it's not just the government that can fix it, it's working with employers and working with other partners too. So a lot more to do.
Brilliant. Thank you very much. So we're going to, I'm going to come back to each panelist now for wrap-up question. And as Chris has said, there is a lot we can do. So the question to each of you is, what is the one thing you would like to happen next? And I'll come back to you in the order that we started with. So I never know whether going first is harder or easiest, because you get to say something that's by the end, often you're trying to find something different. But Gary, over to you.
Depends on how good your answer is, Anita. If it's a rubbish answer, then it's easy to follow. From an employer perspective, I think the thing for me is that employers really push this up the agenda and really start focusing on it and contributing to the work started by the Commission and on the ongoing Keep Britain Working review too. I think we've almost got to a stage where I think in some quarters we've accepted this as just a cost of doing business. And actually, I think we need to see it in a different light and actually genuinely contribute to this debate, this discussion, and start to raise the profile of it. And actually, as it's already said on the panel today, I think it's that interaction with other parties and finding those solutions together. But I think we've got to really start talking about it and sharing what we're finding. I think that's the only way we'll make a real difference here. So for me, it's about, from an employer point of view, it's about pushing it up the agenda, as I say, and making it a really visible topic that's seen as front of mind and something that could make a real difference to running your business.
Brilliant. Thank you. Sandra.
So I think for me, probably two things. One, I think a common framework to support businesses with health and wellbeing. I think that's quite key. I think the other one for me is around the taxable element on health benefits. For me, it's my mantra is we have to have health equality for all, and the taxable benefit is a barrier to that. So I'd like to see some changes there.
Thank you. That's wonderfully practical. Pete.
So I think two things. One, really that recognition and appreciation that the health effects aren't distributed equally, that some are kind of experiencing more of those than others, and that can be because of systemic factors that need attention. And then I would really just build on Gary's point. I think just more sharing about what's being done, what is actually kind of practical. And I think some of those kind of pilots that show promise about how you can practically make changes to flexibility without necessarily like kind of disrupting your models of work is really important. So opening that conversation so there's a kind of clear shared endeavor feels a really kind of critical step, like showing what's possible.
Brilliant. Thank you very much. And Nicola.
Thanks, Anita. I guess I would say recognizing that worker voice is really central to doing this well is crucial. We've seen really good examples on flexible working. People have talked about them. Unions have examples from across the health service as well of when, you know, the apparently intractable issue of helping NHS nurses get flexibility on wards can actually be addressed when you work collectively, you work with the workforce, you think about the solutions and the tech in the round, you put a bit of investment in, you can find a solution that will help more people have shifts that work for their working lives and keep people on the NHS rather than feeling like they have to leave to the agency bank. So there are solutions that can come, but they take time and investment. But it should give us confidence that as we move forward with some of the changes that are going to be put in place to give people rights to secure hours contracts, to make sure that people have got rights to notice of their shifts, to make sure people are paid when shifts are cancelled at short notice, that these can be put in place in ways that will work for businesses, that will bring benefits, and that working with the workforce to implement them is the best way to get it right. And I suppose the final part of what I would say is that we need to focus very much on the gains that we will get from doing this. A few people have asked about what is the investment case. We've got something coming out on sick pay, I think, in a few weeks that looks just specifically at the changes the government has already made to sick pay to make it a day one right and to make sure that all workers, including those on the lowest paid, are included. And it is really clear, it's independent economic analysis. It looks at what the evidence says, and it shows that, even on the most conservative judgments, the gains you get from reduced long-term sickness absence, from less spreading of germs around the workplace when people come into work when they're sick, very much offset the small additional cost of paying the sick pay. So I think be positive, we can do it. The costs come with significant benefits, and involve your workforce in doing it well, because that's how you get the best results.
Brilliant. Thank you. And Chris.
I'll say three things very quickly, but I think just to pick up on Nicola's point, so be bold and be positive about this. I think there's a big opportunity. The second thing I would say is we know that government is doing a lot. It's doing a lot to help people back into work. It's have the Charlie Mayfield review as well. But I think we'd like to see a really clear strategy from government about how this is going to be addressed over a 5 to 10 year period, and have that strategy set out, because it's kind of quite confusing at the moment. And then thirdly, I was just going to pick up on the point we said about more sharing. I think data is a really big opportunity. I think we do lack some data in areas here. We know that employers are sitting on a wealth of data, and insurers indeed will be sitting on a lot of data as well. I think better data sharing is a real opportunity. We've got a world-class kind of research base in the UK. We could be doing a lot more there that could really help guide action. But I think it's a big opportunity.
Wonderful. Thank you. Please, everybody. Well, first of all, thank you to the more than 200 of you who have joined with us during this session, and for the brilliant questions. I encourage everybody to look at the Q&A, because not only were the questions very interesting, but there is some wonderful sharing of best practice examples and information sources and activities that are going on in the Q&A that I have not done justice to, and it's really brilliant and useful. Thank you to our speakers and panelists for very interesting discussion, very positive and uplifting discussion, actually. It's lovely to be at something which actually not only conveys the enthusiasm, but the fundamental belief that things can be better. Yeah, can be much better. Which is not universal events these days. The webinar recording will be available within 24 hours. Chris, do your slides go? I think your slides will be available as well. On the Health Foundation website, there is an area there for the Commission and both the final report and all the links to further information and analysis that underpinned that report, because I know a lot of the questions were interested in more depth and detail there. As we've discussed as well today, there are lots of other sources for, not least from the panelists, of information and events. So thank you very much for joining today's webinar and for a great discussion. And to all of you who work in this area, good luck with all that you do. So important for our economy, for our society, and for individuals. Thank you very much. Bye-bye.